From the makers of vet-recommended Greenies dental treats comes an easy way to support your dog's wellness. Greenies Smart Essentials dry food delivers complete balanced nutrition with science-backed recipes. Greenies supplements, developed by a team of PhD animal nutritionists, offers options to help support healthy joints, digestion, and more. Whether it's mealtime or mobility support, Greenies helps you care for your dog from the inside out. Learn more at greenies.com.
Welcome to Veterinary Vertex, the AVMA Journal's podcast, where we delve into behind-the-scenes look with manuscript authors. I'm Editor-in-Chief Lisa Fortier, joined by Associate Editor Sarah Wright. Today, we're discussing how a practice-wide certification in stress-reducing animal care lowers the rate of patient-induced injuries to veterinary staff in small animal general practice with the co-authors Jean Pavlovsky and Ellen Everett. Jean and Ellen, thank you so much for taking time out of your super busy schedules to be with us here today.
Thank you.
Thanks for having us.
Yeah, thank you so much for joining us, Jean and Ellen. As Lisa said, we're so excited to have you. And before we dive in, Ellen, could you share a little about your background and what brought you to investigating patient handling techniques and staff injury rates?
I'd be happy to. So I am a small animal general practitioner, and this paper was the result of I joined the faculty at the University of Georgia in community practice, so teaching primary care to the vet students. And a small portion of my job was scholarly activity, which I felt like a complete duck out of water, fish out of water. But I knew that I wanted to try to do research that had a really applicable, easy to approach impact on my general practice colleagues and on our patients. So that's kind of where my heart was when I tried to think up what to do. And then I one day was, checking email, and a notification came out from the teaching hospital safety officer about everybody be careful. We've had a few more incidents of bites from our patients lately. Remember safety first. And I thought, there's a huge variation in how often I see veterinary staff getting bitten in the various practices I've worked in and, visited over the years. I wonder what causes that. It certainly ruins your day if you get bitten badly or scratched badly by a patient, but it can be even life-threatening or career-ending for those more serious injuries. So I started wondering about the variables, and then it dawned on me that some places I worked, a lot of the staff had training in either fear-free or low staff handling. In some places I worked, they had none, and we kind of resorted to a lot more of the traditional handling techniques. And I wondered if that was one of the variables that affected injury of the staff. So that's why we looked into it.
Oh, that's fascinating. I'm an equine person, so I don't get bitten too much, but it's certainly a lot of strikes from the hind end coming at me.
When you guys get hurt, you get hurt really bad sometimes.
Knock wood. Jean, how did you and Ellen identify the specific stressors that most affect the patients in the veterinary clinical setting?
It's a really good question. We used our own subjective experience on what the stressors might be. There's a lot of research out there on what the actual stressors within the hospitals might be that can result in various negative emotions and stress and fear and frustration and anxiety. And then we worked really hard on making a survey that would be easy for the participants to answer and provide that input on what those stressors were inside the hospitals. We identified the most common scenarios that we thought led to human injury. And then we focused our survey questions around those scenarios to try to identify where the injuries happen more frequently and how.
And it's one thing to identify the where and the how. How did you actually measure that you improved incomes with this training? I meant outcome.
Yeah, we our I guess our survey went out to a variety of small animal practices. We tried to gauge the level of training and certification among those practices and determine whether or not the entire practice was trained and certified. And that could have been all individual members of the practice achieving that certification or having the entire practice certified. And so then we compared the rates of injuries and the frequency at which people got injured among the groups of practices that we split up into those that got injured, recorded injuries more than once a month or less than once a month. And then we compared those two groups, which were nearly equal. And then that's where we saw the difference. The difference was basically in those practices that achieved 100% certification.
Wow, that's pretty cool. What other findings surprised you?
One of the big ones that we were surprised about is that the practices, there was not a difference in injury rates among practices that used a lot of either pre-visit medication, so things like trazodone and gabapentin, or in-clinic sedation. So maybe, a pet is difficult to handle. You sedate them with some Dexmed, etomidine, and butorphanol or something like that to be able to draw their blood or trim their nails or whatever needs to be done. And those using pre-visit meds and sedation are generally something that these low stress handling programs do advocate for. So we thought we would see more drugs being used in the practices that had more training and the practices, and we thought that that would also correlate with injuries, but it did not. So there was not a significant difference between medication and sedation and injury rate. And we have a couple theories about that. One, maybe pets are getting really, really stressed in practices that don't have training in low stress handling. And then they end up needing to sedate more of their patients because that animal has been escalated throughout the visit. Um, that was kind of the theory that we came up with there. But there could be certainly more to look into with that in the future.
I think too, again, speaking from the equine side, if you really heavily sedate a horse, you get a false sense of security, and maybe you don't move the same. I don't know. Like it always makes me nervous when people are like, "Oh, he's sedated, it's fine." I'm like, "Uh huh."
That's a really good point.
Yeah. Gene, what future directions? I mean, you talked, maybe part of it is the medication part, but what other unanswered questions has this line of research opened for you guys?
You know, uh, there's so much research out there already on the benefits of reducing stress in the hospital for small animal patients. And there are hospitals that have successfully implemented those measures, and maybe they've gone out and achieved some form of certification and improved their culture within the hospital so that everyone is on board and everyone is participating in those measures. And there are hospitals that either don't have an interest in that and don't see value in it, or are struggling to implement those measures. And so I think from the standpoint of data and evidence, it would be interesting to me to find out what it is that's made those hospitals successful that have been able to implement the culture shift, which is, I think, is the most difficult, and achieved lower rates of injuries and maybe even better income, as you had said before, because more happy clients, more happy patients come in more frequently. And so I would be interested to see what it is that's made those hospitals successful.
Yeah, my cat's hospital, they're all Fear Free certified. They have like a little sticker on the door. And I will
Mm,
say anecdotally from like a client perspective, it is really nice like seeing your pet just be a bit calmer and you can definitely see the change. I might just be also just more hyper aware of it for coming from
mm-hmm.
a clinical practice
Yeah,
setting like myself, but it is really nice from a client perspective as well.
for sure. For
Mhm.
sure.
So what are some of the key take home messages that you hope veterinarians will remember from this work?
I think the big thing to send home is that we didn't see a statistical difference in injury rates unless every individual in the practice, so that goes from, the people working at the front desk all the way back, had training. And we had a couple different reasons that we thought that might be the case. As Jean mentioned, the cultural shift. So people are sort of there's gonna be a little peer pressure to follow your training if everybody's been through the same training, or you see your colleague struggling with a patient, maybe getting a little frustrated, or the patient's looking a little stressed or starting to show some signs of aggression. And maybe you step in and say, "Hey, I got an idea. Let's try doing something different." so that we can still accomplish what we need to with that animal without escalating their aggressive behavior. Um, so maybe it's a culture shift thing. The other component that we theorized is that, if the whole team isn't on the same page with reducing stress in our patients, maybe the veterinarian has done fear-free or low stress or cat-friendly training, and maybe some of the more experienced technicians have too. But if your new hire vet assistant who doesn't have a lot of training on reading body language and is maybe a little nervous is the first person to go get that pet out of their carrier, maybe they're a little nervous and they don't know what to do, so they pick the cat up by the scruff. That patient already is escalated before it even meets the more experienced members of the team. And so the early experience that that animal has, even when their owner gets them in the car to come to the vet, maybe they need some pre-visit meds, or maybe they need a different type of carrier, or maybe they need nausea meds for the car ride, and all of that goes into reducing stress in the patient so that hopefully they're less likely to injure somebody and have a bad experience themselves throughout their vet visit.
Or maybe if this was available in the 90s, I might gone into small animal because
Yeah,
Sarah's heard me say this before that I would go in with a nasty bull or a stallion or a mean chestnut mare any day, but a mean cat in the cage, no way. No way
that's
was I going near that cat.
That's a huge part of it. I remember being really scared early in my career, and I worked in a place where there were a lot of young vet assistants who had minimal training, so I knew, like, if anybody's getting the rabies shot in this cat today, it's up to me. I gotta put my big girl pants on and go get this hissing, spitting cat out of the carrier and deal with it, and that was really scary, and I can see why people, I think some of the old handling techniques that many of us were taught just a few years ago, they come from a place of fear and misunderstanding. And so I think that we'll all evolve how we practice medicine, and that includes how we handle our patients. There's no shame. There's no, oh, you're old school and you're doing it wrong. It's just, this is a new way. Let's all embrace it when we're ready. Because I think it's a new, it's going to save us getting hurt and our patients having bad experiences.
Yes. Ellen, was that hissing, spitting rabies cat or cat getting a rabies vaccine the sentinel case, or was there another case that made you realize the importance of handling techniques?
At that point in time, I did not have much exposure to some of the training protocols that are out there now, and I was just doing my best, and I certainly also, scruffed many a cat and, didn't know any better, and I heard colleagues say things like, "Oh, fear-free training is just feeding peanut butter and not putting a muzzle on, and you're more likely to get hurt if you're in a practice that's into fear-free." And that individual who said that obviously hadn't seen the content of these training programs, or they wouldn't have been saying that because it's not true. But I think there's just a lot of misconceptions and maybe some stubbornness, maybe some shame. So if, hopefully we can all keep an open mind. And now there's, as we've alluded to, kind of a monetary incentive for practices to get their staff this training. If you have not as many people getting hurt, missing work, driving up your workers' comp insurance rates, that's a positive for everybody.
So, Jean, looking ahead, what are the next steps to research in this area?
Well, I think it's interesting that that question came up because even since our paper, there have been papers published on similar topics in what I thought was a good direction. Other people have picked up. For example, there's been 2 papers already evaluating the patient handling methods and their impact on physiological and behavioral measures. So how does the way we handle patients change their physiological parameters and their stress scores? That's already been looked at. There's been a paper that looked at the cost comparison between sort of early and late sedation. How does this impact the cost of care? So I think for me, as I sort of alluded to in a previous question, I think for me, I would really be interested in knowing the specific factors that go into successful implementation of these programs. The programs are out there for veterinary teams to participate in and engage in, but how does that actually happen? Then what is it that makes them successful? So somehow I think in order for this to become a more widespread, acceptable way of doing things, we need to know what it is that's made others successful so far.
Yeah, I think that'd be a great question too to look at in avian species as well. I think there is like a fear-free program for handling birds too. So yeah, definitely very interesting. And Jean, kind of going along with what I just asked, but are there any other specific areas that you think are most in need of deeper investigation or refinement?
I think I think it sort of goes along with the initial question on how to change the culture. I think it would be this may be a little digging a little too deep into the psychology of being a veterinarian and veterinary professional, but I think that in a lot of cases we become somewhat immune to our patients' emotional stress, and it has been actually shown that human medical practitioners and providers do become somewhat immune to especially children's emotions when they're undergoing medical procedures, and it sort of becomes uh, this is the way we do things, and in order for us to be able to get this done, we need to be able to restrain this child or something like that. So I think that's trying to figure out why it is that we become immune to these types of things, and maybe finding ways to bring back the reason why we're actually in this professional, as I think Ellen alluded to this. And if I may just add to what Ellen had said, I think that for me, this type of a topic became important for a couple of reasons. One is having children myself made me think about how scared they may be going to a medical professional. I have one kid that has a fairly immense fear of medical procedures, and then having my own animals that become scared. I think it just kind of triggers a little bit of compassion and it kind of makes you think differently about what we do. So I think kind of digging into this sort of underlying reasons for why we sometimes don't think of our patients as being scared and instead think of them as being mean, that changes your perception and the way you approach them, I think. And if you think of them being scared or stressed versus just, homicidal and trying to murder you, I think that probably changes the way you handle them as well.
Yeah, I think that's a really good point. I even see it at the barn that I ride at. If a horse is like jigging around and they're about to change a bandage or something, and I've seen people get upset with the horse. I'm like, calm down. They're just afraid.
Hmm.
They're just
Right.
afraid that that might hurt.
Right. Yeah. I mean, the fear of pain is real.
Yeah, yeah, and like you said, it's a culture shift.
Hmm.
Gene, were there particular experiences in your education or early career that shaped your approach to this topic?
Yeah, I mean, for the first few years of my life, or my my career, I did the same things that everyone else did, and implemented the same handling measures. And I've seen, um, uh, I mean, honestly, unnecessary suffering, even physically. I mean, the use of local anesthetics for the sake of time, handling patients in such a way that just made them more scared. And when I compare my early career to my later part, I got hurt more doing the things that I was taught to do then. The scruffing of the cats and holding animals down until you got things done made people get hurt more. And so then when we were in the initial parts of this study, it seemed obvious to us, at least subjectively, that the way we handled patients impacted how much we got hurt. And so there were probably dozens upon dozens of specific examples which made this easier to launch, in terms of the study, but it all really surrounds the same thing.
How about on the people side, Ellen? Were there any mentors or colleagues that played a pivotal role in guiding your thinking on this topic or in research methods in general?
Well, we have to definitely give a shout out to Dr. Julie Albright. She's a board of behaviorist, and she was my behavior professor in vet school. And I sort of took an interest in it, not enough to become a behaviorist myself, but I've always, sort of kept an ear perked whenever interesting behavior topics were being talked about at continuing education conferences and things like that. Um, I'm not afraid to tackle your, basic general practice level behavior problem, whereas I feel that a lot of vets are sort of feeling out of their element with that sort of thing. So she helped us with I reached out to her, because I said, "I've never published a paper before. I need help. I don't even know where to write how to write one." And she kind of was our coach on this paper, as well as, the wonderful statistician at UT who, got all the numbers sorted out properly for us and made sure that our survey questions were, unbiased and we're not going to lead our respondents to answering a certain way. So that was really important to us, and we're grateful for their guidance.
Yeah, it's important to have a good team. A good foundation really helps you along the way when it comes
And
to writing.
everyone on the team was very patient because I had very little time between teaching and seeing patients to work on this, and the project was also interrupted by 2 maternity leaves, so it was spread out over a couple years, but we got it done, and definitely Jean was, very instrumental toward the end in getting us across the finish line.
Awesome. That's great to hear. And Jean, looking back, is there any aspect of your training that you now see differently because of this project?
There wasn't a whole lot of behavior training in vet school at all. I remember graduating and just the most basic of things. I thought back and remembered that no one taught me how to potty train a puppy. You're just supposed to figure this out on your own, you know? So there wasn't much in my vet school career. And the advice that I got from people that mentored me is no longer considered to be the standard advice for managing behavior. A lot of it was based on outdated theories like dominance theory and things like that. And so in retrospect, I would have probably been happier and avoided injuries more if I had, if the behavior science was where it is now and if we were taught differently. I think I think we all probably would have benefited from that.
And that's one of the beauties that I loved during my time teaching, and I think you probably feel the same way, Jean, is that we can have this opportunity to give some of this information to vet students now and make this a little bit more mainstream.
For sure.
Fantastic. Ellen, what is one tool or technique that you use every day in this aspect that you can't imagine practicing today without?
You know what? Every time that I open a packet of Churu for a cat patient, if anyone doesn't know what Churu is, it's this very yummy, very aromatic treat that comes in like a little tube, and they lick it right out of the package while you examine them or draw their blood or whatever it is you need to do. And it is like very addictive for cats. Even the most scared kitties will get a little whiff and then come and say, yes, I need to lick that. And a lot of them that is the restraint, letting them lick the churu. They're so into it that they don't care what you're doing. And every time I open it, reach over and grab a pack of churu and open it for a kitty, I'm like, how did we ever even do anything with cats before churu? It's amazing. It's amazing stuff.
That's amazing. Jean, how about you? What's your tool that you can't imagine practicing without?
Mine's more of a technique. There are dogs that are super stressed and scared, and you can't even touch them. Like you want to sedate them, but in order to be able to sedate them, you have to approach them, you have to handle them, you have to poke them with the needle. And so for me, the drive-by sedation technique has been sort of revolutionary. It's a sort of a hands-off way to sedate a dog without having to restrain them at all, which makes a huge difference. So that's been a game changer for me.
Very cool. And Jean, what's a common misconception about low stress handling that you really enjoy clearing up with people?
Yeah, and then I think Ellen sort of referenced this a little bit, but the common misconception is that minimal handling actually increases injuries. I've had people say to me in response to a statement such as, well, we don't recommend scruffing cats. The response at times has been, well, do you want me to get hurt more? Do you want me to get bit? So like there is a misconception out there that handling them less will result in more injuries. And the corollary to that is that the more you hold them, the more you restrain them, the less likely you're going to get injured, which is actually the opposite of what we found in our study. And it makes sense because most animals do feel threatened when they're restrained more. And the more threatened they feel, the more protective they're going to be and the more aggressive they might become. And so the more you hold them, the more uncomfortable they become, the more scared they are, and the more aggressive they are. And so It's not an easy conversation with people who are really set in their ways and are averse to learning a new technique or changing things they do. But it is something that I like to talk about because I think it's important to clear up those misconceptions.
Yeah, this is another good Mythbuster episode. It's also so hard to like retrain your brain about something. I feel like it's like a
Yeah,
knee jerk to scruff the cat, right? And you have to remember, oh no,
definitely.
like there's different ways we can do things. Yeah.
Right.
Or the
For sure.
big hugging a dog against your chest
Yes.
for restraint.
Hmm.
It's just what we were all taught.
Yep.
Even, like 5-10 years ago,
I
that
spot that.
was
Yeah.
standard. And still is being taught by some
Hmm.
individuals in some institutions. So it'll come with time, I think. But the more we can open people's eyes and help them realize that there's a lot of good reasons to embrace this, I think it'll be mainstream someday soon, I hope.
Well, baby steps, we're getting there. And Jean and Ellen, thank you so much for joining us. Really appreciate you being here today.
Thank you for having us.
Thanks very much.
And for our listeners and viewers, you can read Jean and Ellen's article in JAVMA. I'm Sarah Wright here with Lisa Fortier. Be sure to tune in next week for another episode of Veterinary Vertex. And don't forget to leave us a rating and review on Apple Podcasts or wherever you listen.